Hello everyone. Today we will cover a topic that comes under midwifery and obstetrical nursing, that is known as medical termination of pregnancy. First we will see the introduction. What is induced abortion? That is a deliberate induction or termination of the pregnancy with a medical or surgical method is known as induction of abortion before the viability of the fetus. Next one is if you see globally, most of the countries still medical termination of pregnancy is not legalized. But in India, the Medical Termination of Pregnancy Act was initiated in the year 1971 and it came to enforced in April 1972 and action in 1975. So we will see what is MTP, what is the meaning of medical termination of pregnancy. That is the deliberate termination of abortion by medical practitioners in order to save the life of the mother under the legal act. So this is the meaning of medical termination of pregnancy. So we will see what are the indication. Mainly first one is therapeutic indications or medical indications in order to save the life of the women both mentally and physically. If suppose the woman is having cardiac condition or diseases grade 3, grade 4, severe glomerular nephritis, malignant hypertension, intractable hyperemesis gravidarum, if the woman is having epilepsy, psychiatric illness. So these are the major life-saving conditions of mother. Next one is social indication. Social indication, if they have any failure of contraceptions, already low socio-economic status and they have so many children. The next one is rape condition. And next condition, if you see under 18 years of pregnancy, mentally handicapped situation. So this we can consider as a social indication. And third one is eugenic. If the child having any disability such as chromosomal disability, congenital abnormalities, genetic abnormalities, the child with severe infections like rubella, viruses and all, and if the teratogenic effect, any drug induced or radiation exposure or chemical exposure, this will leads to disable of the fetus. Then we can go with the choice of medical termination of pregnancy. Next we will see what is the recommendation. So recommendation, if you see this MTP has to be done by a medical practitioners and they should get a 6 months of training and at least 25 MTP they should conduct under by the guidance of registered medical practitioner, and they should have a degree or diploma in the medical practitioners in obstetrics and gynecological. Next, if you see what are the criteria. First one is the MTP has to be conducted in a authorized legal hospital or government sanctioned private hospital also, and this has to, if it is a minor 18 years below or mentally handicapped, then they can go with consent of the guardian or the parents. If they are having good healthy, the women can go with the own consent, not the husband side. And if the gestational week is more than 12th week of gestation, then 2 medical practitioner has to be given the permission for MTP, and this has to be kept very confidentially and the report has to be sent to the director of health services. These are the main recommendation. Next we will see what are the methods that comes under the medical termination of pregnancy. Mainly 2 methods are there, medical methods are there, surgical method are there. So first we will see what present in the first trimester or the early trimesters, that is from the 1st to 12th week, 1 to 12th week of gestation. So here first one is medical method. Medical method, if you see first method is medicines, use of medicines. One is mifepristone. Mifepristone, it is a anti-steroid drug that is it will destroy the progesterone action, and this will go with the decidual necrosis and bleeding action, and the blastocyst can be separated from the endometrium, and the abortion process will be start. That is mifepristone. The next one is misoprostol, that is the prostaglandin. This will have the action of uterine contraction and cervical thinning of cervix, ripening of the cervix. So, if you see third one is mifepristone and misoprostol, combination of the drug. First day they can go with mifepristone 200 milligram of mifepristone orally. On the third day 400 milligram to 800 milligram vaginally they can place the misoprostol, and they can see the expulsion of fetus in a clinical area. Then next third one is methotrexate and misoprostol. Methotrexate, it is a anti-cancerous chemotoxic drugs. This will go with lysis of the DNA and initiate the abortion process. So, methotrexate 50 milligram per meter square IM injection can be done. After 7 days they can go with misoprostol medication, oral or vaginal. Then tamoxifen and misoprostol drug of choice is it. These are the early below 12th week of gestation medical induction. The next one is surgical induction. Surgical induction, first method is menstrual regulation, that is the aspiration of endometrial content from the cavity of 14th day of missed period in a normal cycle women. So, here aseptic technique can be done, but they can go with cleaning the vagina and all, identify the anterior lip of the cervix, posterior vaginal speculum can be given, cervix can be dilated, and the catheter 5 mm to 6 mm catheter can be placed, that is a Carman one, attached to the syringe, 50 ml of syringe, and this can be pushed in and out, rotatory movement, the content can be aspirated, and this fluffy feathery type of content can be placed on the normal saline and can be visualized. And second one is second method is that is a manual vacuum aspiration, that is a hand operated double valve catheter can be placed inside the uterine cavity, and the suction of 660 mm Hg can be given, and the content can be evacuated, and this all can be done in 53-63 days inside of gestational week. And next method is suction evacuation. Suction evacuation, the product of conception in the uterus can be sucked out with the catheter attached to the suction apparatus. So, all the aseptic technique can be done, and here dilate and the vaginal speculum can be placed, then next cervix can be dilated, and the catheter can be placed inside the uterine cavity, and suction can be given, that is 500 to 600 mm Hg, and this can be rotated in and around, and the content can be evacuated in the suction evacuation. And last method is dilatation and evacuation method. In dilatation and evacuation method, dilating the cervix and evacuating the uterine content. So, here two methods are there, one stage operation is there, two stage operation is there. One stage operation along with the cervical dilatation, we can go with evacuating the content. Two stage operation here, first we can give a medication of prostaglandin or laminara tent. Laminara tent, it is a osmotic hydroscopic material that sponge like placed on the cervix. It will absorb the water in the cervix and it will be dilating. After dilating the cervix, we can go with evacuating the uterine content. So, here also all aseptic method, visualization of the vagina, anterior speculum can be placed, the cervix can be dilated, and then with the curettage they can remove all the uterine content. So, all the procedure we can use the ovum, that is the uterine sound, in order to identify the length and position of the uterus. So, next method is second mid trimester. Mid trimester also medical method is there, then also surgical method is there. Medical method, first one is misoprostol, that is 400 mg of misoprostol sublingually can be given for the women in a divided doses. Next one is carboprost, that is 15 methyl prostaglandin F2 alpha IM injection can be given. Then gamiprost 1 mg of vaginal pessary can be given, placed in the vagina, that also divided dose can be given. And last one is dinoproston. Here they can go with 40 mg of dinoproston can be placed on the vagina, and they can see the expulsion of the fetus. These are the medicine. Another one is oxytocin. This drug 50 international unit of oxytocin can be dissolved in 500 ml of normal saline, and this can be seen the effectiveness of expulsion of the fetus. Maximum of 300 international unit can be given for the women. Next, if you see what is the other methods like intra-amniotic instillation of hypertonic saline is there. Then next intra-amniotic instillation of hyperosmotic, that is the urea, 40% of urea, 80 gram of urea can be dissolved in 200 ml of distilled water. The next one is extra amniotic instillation of 0.1% ethacridin lactate, that is 10 ml per week can be given, and extra amniotic instillation of isotonic solutions are there. And another surgical method, dilatation and evacuation can be done, and hysterotomy procedure, opening of the abdomen, removing the content. Next we will see what is the complication. Immediate complication is there, late complication is there. Immediate complication, cervical laceration, uterine perforation. Then next bleeding will be there, shock will be there, sepsis will be there, water intoxication can be happen. These are the immediate. And post abortion triad symptoms, fever, bleeding and pain will be there. The next one is late uterine. If you see, they can go with gynecological complication, infertility can be happen, menstrual irregularities, uterine synechia, uterine adhesions, pelvic inflammatory diseases. Then for the obstetrics, future recurrent abortion can be happen, preterm labor, premature rupture of membrane, uterine rupture, fetal distress, all the problems can be occur. And as a nurse's role, we have to immediately after emergency complications can be identified, and we can treat that. Post abortion care can be given, and our contraceptive measures counseling can be given, and this can be refers to the reproductive measures group. So today class we have seen about what is MTP, what are the recommendation, indications, and what are the methods and complication, then nurse's role. So I am signing off, Mrs. Nima. So next video we will meet.